Hello everybody, my name is Victoria McAtee and I'm the marketing coordinator for Winnegar Plastic Surgery.
And my name is Tyler Kirkpatrick and I am the marketing coordinator for Lux, a medical spa.
We are going to start a series called Aesthetic IGTV, where basically we discuss plastic surgery and medical spas.
So with these episodes, we're going to dive deep into all of the services that we offer and the differences between both practices.
And the topic we are going to cover today is
lips.
So first things first, we're going to discuss how our lips age. Just like our face changes with age, so do our lips.
So a loss of thickness in the skin as well as subcutaneous fat can cause the appearance of more of a dehydrated look, as well as loss of volume in your lips.
Okay, so if you are experiencing loss of volume, a more dehydrated look from aging, maybe some droopiness, that's kind of the time to ask, can plastic surgery help me, or can a medical spa help me? How do I know which practice to go to and which can benefit me more? What is a better fit for me?
So a medical spa like Lux is there to help with loss of volume to an extent with the use of fillers.
Correct, and a plastic surgery practice like Winnegar Plastic Surgery can correct loss of volume through the use of fat grafting. So fat grafting basically is when you harvest your body's fat from a donor site. Say it could be your lower stomach or your flanks, wherever that problem spot may be. You can take some fat from that, and then the doctor, in this case Dr. Winnegar, will then take that fat and inject it into your lips, and then this is a long-term kind of permanent fix to that volume loss.
Whereas fillers, those will only last a certain amount of time, so you are going to have to come back to get the results you're kind of looking for. Maybe just depending on how fast your body metabolizes them, could last anywhere from 6 months to even up to a year and a half. And there are many type of dermal fillers that we use. The main ones that we use are based off of hyaluronic acid, so your body does naturally produce that. So just putting that extra HA in your lips is going to help with the volume that you really want to kind of achieve there.
And you might ask yourself, how do I know which one I want to choose, which option? And that really depends on how committed you want to be to the volume. So say, you just want to try it out a little bit, you don't want to be fully committed, fillers would be a great option.
So at Lux, we do offer many different types of fillers. Now it just kind of depends on the look you're going for. My personal favorite, I absolutely love this product, is Wrestling Kiss. It's more of a softer product. It really just makes those results a little more natural, but of course and the syringes are buildable, so you can use up to more than one syringe. We usually just try to start with that one syringe to see how your lips look after that. You won't get the full results until 2 weeks after. Of course you'll be able to see the results immediately after, but that's when the swelling goes down, the bruising goes down, and then those that natural look is going to be achieved after those 2 weeks. So there are many different products, as I was saying, that you can use in your lips, and that's where the providers come to play. What they can do is just during your consultation, just discuss kind of the result you're going for and what would be best for you.
So what if you're experiencing some drooping of the lips? This is when a lip lift may be a good option for you. Our upper lip actually ages over time and becomes longer. A classic lift is when the surgeon will basically make an incision right beneath your nose, and he will remove a little skin, and then when he sews it back up, it will move the lip into a better location. And sometimes when you do that, the corners of your mouth are still going to be a little downward, which is when your surgeon can even remove some skin right above your corners, lifting that part up as well, essentially giving you a fuller upper lip. As for wrinkles or those smoker's lines that you get around your lips as you age, at the plastic surgery side of things, you can do laser resurfacing. Dr. Winnegar refers it as to basically ironing out the wrinkles. He'll take that laser and smooth out those lines, almost like sanding out those wrinkles, and it will take about 2 to 3 weeks for recovery.
Now, just like lips, just depending on how fast your body metabolizes that product, it can last anywhere from 6 months to a year and a half about. It also just depends on the type of product. So now, a full syringe of filler, it sounds like a lot, but it is not at all. And many times when people want their lips filled up with volume and also those vertical lines around their lips, they may need more than one syringe, just depending on the patient and you know, how severe those lines are and how much volume they do want in their lips. So this right here is an example of 1 milliliter, which is 1 syringe. It's not a lot. So when people, you know, hear, oh yeah, you're gonna need 2 to 3 syringes, a lot of people freak out, but they do not realize how little of product is actually in that.
So thank you so much for joining us on this first episode regarding lips, and we hope to see you soon in the next episode.
And if you have any questions or comments, feel free to comment below.